From Prevention to Recovery with Marcel Gemme.
Welcome to From Prevention to Recovery. I'm your host, Marcel Gemme. Today's episode brings together two people who are doing something both simple and innovative, putting tools that save lives directly into the hands of ordinary people. My guests are Dr. Susan Murphy, president of the West Virginia Drug Intervention Institute, and Joe Murphy, entrepreneur and inventor of the ONEbox, a tech emergency overdose response kit now deployed in all 50 states. Together, they've built an organization that sits at the intersection of public health, innovation, and community action. West Virginia has been ground zero of the opioid crisis for years, and rather than waiting for the system to catch up, Susan and Joe decided to build something different. Welcome to both of you.
Hey, thanks for having us.
Thank you so much.
So before we get into the ONEbox program specifically, can you each tell us a bit about how you got into this field, what brought you there?
Yeah, I'll go ahead and start. So I actually have been in higher education most of my life, either as a professor, an assistant professor, vice president for student affairs, dean. My last stint was as an assistant dean at a pharmacy school here in West Virginia. I took pharmacy students out into the community, specifically elementary schools, to talk to young kids about medication safety and safe medication use, because as we know, the opioid epidemic really started with prescription medication. We're in a very different place now, but that back then it was all about prescription medication, and that was really right when things were starting to get a little more regulated in terms of opioids and prescription opioids. I also had the opportunity to take some of our fourth year pharmacy students. They were required to do rotations in the community. And so they did some of those at a local harm reduction program at the health department. And so got involved with the syringe service program at that time. And at first, I was just going and taking patients back to rooms because my background is in education. It's not necessarily in public health or in medicine. And one day it was just extremely busy. And the director looked at me and said, "Susan, I need you to run a room." And after that, I started seeing patients on my own and talking with them about recovery resources, infectious disease, and things of that nature. So just got really, really kind of interested in the field and got a passion for it. I grew up in Detroit during the 70s and 80s during a very different drug
Oh, yeah.
epidemic. My mom was a neonatal nurse, and so a lot of her babies that she cared for were actually born with what we now call neonatal abstinence syndrome. It wasn't
Mm.
called that back then. So we had some experience with a very different drug epidemic. I also, unfortunately, responded to an overdose on a college campus. And that was just devastating. There was not naloxone in the residence halls at the time. The worst part of it was, quite frankly, cleaning out that student's apartment with their parents a week later, and just knew that I didn't want to see another parent experience that. Joe and I, between us, have 6 kids, and they're all young adults now. But I think every single one of them could probably share their own experience with losing a friend or an acquaintance, unfortunately, to drug overdose. So just became very passionate about it from that perspective too.
And Marcel, I grew up in what is known as the epicenter of the epidemic, Huntington, West Virginia. Made national news several times, but I was unaware. I had moved away for a few years, and I came back. I started hearing, you know, early social media. I would get a message that this schoolmate died, or this person that I used to work with died, and I thought, wow, you know, that's pretty odd. So I moved back in around 2006. Again, just the amount and number of overdoses and deaths in my city were just alarming. And I owned a media company. Again, I came from this from a completely different realm altogether. So I started, you know, just noticing it more and more. And then one day I witnessed an overdose, and it was a very wealthy, very prominent citizen in my town and a friend. And we had no idea he had a problem, but he had a prescription drug problem, and he
Oh,
overdosed right in front of me. He lived, but it was a long, long day. Obviously,
I'm sure.
I didn't know about rescue breathing. I did my best. I was pouring water. I was doing all the wrong things. Uh, and that's when, again, very prominent citizen, I realized this was something really big was happening. And I started calling it the equal opportunity destroyer.
Mm.
This, if it could take this guy down who had everything in the world, wow, the regular population didn't stand a chance. So I just started sticking my nose in. The very first thing I did was make a video. I
Mhm.
noticed these kids were singing a song about Oxycontin, and they were on the school bus. They were 10 and 12 years old. So I'd made a little shocking video. And then I was like, this is not enough. Just raising awareness. How do I get my hands in there? So I met a lady that you've had the pleasure of knowing or
Yeah,
meeting, Jan
absolutely.
Rader.
Yeah.
And I went directly to her and said, what can I do? To just here's what skill set I have, but I'm a problem solver. What can I do? And so Jan and I made then what we believe is the first training for naloxone on video, the very first one we think, and it was about 2008. And we made it available on YouTube. And she went around and kind of spread the word and told people about the video. And we had thousands of views. And we thought, wow, we're doing something.
Yeah.
But then the problem just ramped up to a level that neither one of us could ever imagine. In our little town of 50,000 people, 28 people overdosed in a period of about 4 hours.
Wow.
And that's when eyebrows started to raise. And I think that's really when I decided to spend the last almost 20 years of my life trying to solve this problem. And along the way, I've met amazing people, even a wife,
Good.
all share the same passion. And again, I've just always tried to do whatever it is at
Yeah.
that moment that was the next, right thing, especially as this epidemic has changed
Yeah.
faces so many times.
Good, good. I mean, there was some positive. You met your wife, which
Yes,
is
I
very
know.
good.
I know. Well, again, we got so passionate about it, there weren't very many other people around us. We were always always
I was
together.
busy.
Yeah. And we saw the passion each other had for, again, neither one of us have an opioid problem, but
Yeah.
we had a humanity problem, people hurting and dying that we loved. Uh,
Yeah.
you know, Many people that were in my kindergarten class, some of my high school best friends, entire classes I had wiped out with overdose and death, and
Wow.
it just didn't want to stand by. Also, being a father, I know that you don't have to extrapolate much to know it's coming for that generation next, and
Mm.
so I wanted to do something, and so we made it our lives.
Thank you. Now, Susan, you've been leading the Drug Intervention Institute for years. What's the core mission? And as the opioid crisis evolved, how did the Institute adapt to keep up?
Those are great questions. So the Institute was founded in 2019. And so I'm the first and the inaugural president. And so I think May is 7 years that I've been at the Institute. Our mission, it seems simple when you state it, but it's a pretty lofty mission, and that's to reduce overdose deaths across the United States.
Mm.
And we started by really focusing pretty hard in West Virginia in particular, because that was
Mm.
our backyard. That was where our initial funding came through a private gift. So we were very fortunate to focus a lot on prevention and working with school children in particular. And then we've sort of evolved over time to be focusing on Appalachia, and now we really have a national footprint and national recognition. Part of that is due to the ONEbox and its footprint across the United States. I also think we've shifted some focus, whereas in the beginning we were talking more about prescription medicine. So a
Yeah.
lot of our focus in the very beginning was on medication safety, talking to youth and adults about not sharing medication, disposing of medication correctly. And we still do that education. It's still important. I don't want to make it seem like it's not, but as prescription drugs became more regulated, then we saw folks turning to heroin, unfortunately, because those prescription drugs were not as readily accessible, which was a good thing, but it also caused us to switch to a different, a more illicit drug. And so we were doing a lot to talk to people about overdoses and using naloxone to reverse overdoses. And unfortunately, we had the pandemic that happened. And so the world kind of shut down. And at the time, naloxone was not over the counter. And a lot of the state standing orders in the United States required people to be trained before they could receive naloxone. And it just became impossible to train a critical mass of people. So we worked with our state office of drug control policy to implement an online asynchronous course that people could take at any time, 3 o'clock in the morning on a Saturday, 6 o'clock in the evening on a Thursday night. They'd go through that course, submit their certificate, and then we would mail them their naloxone in the mail. So that was a way for us to kind of, reach people at a time really where everybody was very isolated. So we were fortunate to be able to work with some partners to make that happen. And then we've also seen this wave, right, of counterfeit pills and fentanyl in the drug supply. And so, something near and dear to my heart is college campuses. But, the whole counterfeit pills and, college students and high school students sharing Adderall that is not from a prescription
Oh,
that, then they overdose because it's laced with fentanyl, or a fraternity, brother overdosing by trying cocaine for the first time, which is not an opioid, but then it's laced with fentanyl. And so that person overdoses. So we started to really focus really heavily on college campuses. And that's really, and we'll talk a little bit more later, I'm sure, but that's
yeah,
really was the impetus for the ONEbox too.
that makes sense totally.
From a
Now, Joe, walk us through the moment the one bucks idea was born. What problem were you trying to solve, and why did you think technology was the answer?
Well, again, I think it goes back to that first shipment of free naloxone that Jan got. And I think it was 2008, 2009.
Uh-huh.
They dropped it off on a pallet. We were just so relieved. And then we realized with the state standing order, we had to train every single person
Yeah,
that was going to get the naloxone.
yeah.
So that is when Jan, who was then a fire chief, told me, oh, I hate to be on camera. Don't put me on camera, which, fast forward now she's an Oscar-nominated personality, but it started with that problem. How do we get people this simple training? Look, that it's not rocket science. It's very simple. We've never claimed that this is a hard training, but it's getting that training in front of as many eyes as possible, so people have the confidence to go forward with not being a bystander and being a first responder on the spot. But for me, there was a very specific moment that this came through. And again, with my media background, it was make a video. That's what I knew how to do. Along the way, I made apps. I made an AR, VR experience, just anything to get eyes on it. But I was sitting and really for a long time, I thought that prevention was where I could do the most. And I really worked on prevention. But Susan and I have always said we have to bookend. We have to keep people alive in order to, do both sides of the mission. But I think it might've been during COVID or right after COVID. I was having lunch at a table where Susan and another lady were trying diligently to solve a single problem. They wanted to put and had funding to put naloxone boxes on every campus in West Virginia, but they kept coming up with the same problem. Number one, they couldn't get enough of the boxes at that time because the supply chain was just shot. And they were buying a brand of box then. And again, I've always said from the beginning, get a box, get somewhere that you can identify to put naloxone, and that works. I don't care if it's a one box or, just somewhere that you can say, there's where it's at, go get it. Now we need it. So they couldn't get enough of the boxes, even though they had the funding. And number two, they were sending them out to these schools, and the deans and the presidents of the schools were sending them back. And they were saying, no, it doesn't have training. I'm not going to take liability. I'm not, I can't do it. So the very first thing I did, I was like, well, we have to get this information. We've already made this video and built this course. Let's put a QR code on existing boxes, different brands that were out there. But for me, it all boiled down to failure points. When you're in this situation, and now at that point, I had been in that situation, every single thing is coming at you. I saw all these boxes on the market, like some had a hammer, you had to break a glass, some that were filled with so many things that I couldn't imagine being in an emergency, and all this stuff just flying out at you. And then I even broke it down to my QR code idea. And I was like, we live in West Virginia. 90% of these boxes are going to be in rural communities that may not have cell phone access. It may be a person that doesn't know how to use a QR code. Ask my dad how to use a QR code, and he's going to.
Exactly. Yeah.
So it hit me that day at the lunch table while Susan was trying to solve this problem with a colleague that we just have to make this as simple as possible, as redundant as possible, fail safe in every way. And somehow I had to get the video into the box. So that was a Friday. I spent the weekend with a glue gun and a soldering iron and made all kinds of just horrible prototypes. But by Monday morning, I presented Jan and Susan with what I thought was an idea that we could scale this effectively. For us, it's all about location, right? So
Yeah.
proximity is so important. Just having a purple box, be purple, and you can say, find the purple box, got that proximity fixed, immediately. And then emergency response, obviously, and then a training component. I wanted it to be, if you wanted more, if that dean wanted more, that president of the college wanted more than just a 60-second emergent training, I wanted to give them all the information so they felt equipped. Because at the end of the day, if you don't feel equipped and ready to respond, then it doesn't help anyone. So it all happened in a single weekend, really, for me.
Okay, good. So now for listeners who haven't seen one, describe what the ONEbox actually is, what's inside.
Sure. So again, this is the ONEbox. It's very simple. It's not rocket science. But it's purple for a reason, obviously. Purple being the color most associated with overdose and recovery and prevention. But more than that, it's a simple waypoint when you scream out, someone grab the purple box. And we've heard story after story, grab the purple box out of my trunk from behind the bar, grab the purple box. So the color itself is a technology. This seems so simple, but it works. So when you open the box, and again, it's a sealed, weatherproof box. Again, with the medicine, we always say it can't be in extreme cold or extreme heat because we want the efficacy of the medicine to be there. But it's a simple sealed box, and everyone ships with 3 PPE kits because, again, one of the things we saw immediately were bystanders didn't really want to jump in, especially with the bloodborne pathogens and all of the risks involved. So I put a CPR mask in, simple gloves, and some wipes because wipes are great.
Yeah, for sure.
Sometimes things get messy. So 3 of these, so you could train with one, you could open it up, you can kind of look and see what's in there, and then you have 2 more that are locked in there. And when I built this box, and I still believe it holds true, every brand of naloxone would fit in its original packaging in there. So for me, they already have 3 sets of instructions in every single 2-pack of naloxone. So that's another redundant set of instructions. So again, even if it was just a box, for us, that was a step in the right direction. But then I added this tab, and I added a magnetic pull so that there's no question. You don't have to make choices. You don't have to, it's not a user interface. You simply pull it and open it, and you get our friend.
First off, let's take a deep breath. Step number 1.
It's Jan Rader, as you know, in both English and Spanish.
Primero que nada, respire profundo.
And
El primer paso.
It will only do that unless you press the training button. So again, it's foolproof. There's another set of instructions for brand of naloxone built right in. If you need to rip that off and take it with you, it works. And there's also a QR code and an NFC tag. So if you just tap your phone on there, it will give you instructions. For me, I think we have 9 sets of instructions in here. That way, God forbid the battery dies. They have a 5-year duty cycle, but if you don't charge it, they last sometimes 2 and 3 years if you're not opening every day. But if the battery was dead, I didn't want to cause a life, cause a life. If the QR code doesn't work, you have other sets of instructions. You can rip it off. For me, it was about redundancy. And then also getting the training, the final component, and this was really important. This is how I think we really made way with like the college campuses is this training mode. And the training mode
First off,
is a way more in-depth 6-minute video, everything you ever wanted to know about naloxone and more. So at first I wasn't going to add that. And then Susan encouraged me to do that. And I think that it really opened up a lot of doors for people with questions. So anything else I'm forgetting about the
No.
ONEbox? Again, it's very simple. I always say it's not rocket science. It just, to me, was an aha moment, and it just keep it simple. When I originally developed it, I had so many other bells and whistles, a solar panel.
Sure.
I had LED lights to tell you if it had naloxone or not, an LED light on the inside, all of these things. And then at the end of the day, I wanted to work on getting the cost down, and I wanted to work on making it as simple as possible with as little room for error as possible. So,
Yeah.
and that's
Yeah,
how
so
we,
people doesn't ask like, oh, like what's the lead light? Is it because whatever,
yeah,
So
exactly. So basically very simple. And then we also have another version. We have the, is it the,
Yeah, we have so it's a co-location kit, same concepts, but it's intended if you're putting your naloxone in an AED or near your fire extinguisher or in a first aid kit, and you want to include that video instruction in those places, it's just the video itself with the teeth.
okay.
so it Velcros in to the inside lip so through the glass of the AED, it says opioid overdose response inside. So it's basically a little sign on the back. And when you swing the door of the AED open, again, it's the exact same format.
Okay.
English, Spanish, and training. And it comes with, you see these usually with AEDs, a little triangular sign telling you naloxone's there. For a lot of, again, campuses is what we really built
Yeah.
this for. This gets them into the life-saving business without, sometimes takes a few steps and breaking down the stigma. Again, this box
Yeah.
breaks down a lot of stigma. But it's a great first step for them to add naloxone to what they already have, because every single one of these schools, all these businesses that we deal with, they have AEDs and fire extinguishers. So we were just trying to figure out how to get them equipped. So we came up with that second one. That was actually her idea.
Then that's perfect. Now in a small box, so there's a glove, mask, Narcan, and wipes.
Yeah. So we don't
Okay.
provide the Narcan. We've always said, in almost every single community in America, especially, there's some free naloxone right around the corner.
Yeah,
Also
absolutely.
now with it being over the counter, it's really changed things. And we didn't want to be brand specific.
Okay.
We also didn't want our boxes to expire really quickly.
Because
So,
the Narcan expires, right? Okay.
so again, yes, it's a CPR mask,
Okay.
gloves, and wipes, and it comes with 3 sets of them. Again, we always encourage folks to open one box and see the tools, understand how the CPR mask works, and then you have 2 extras, because a lot of times in situations, and I know Susan talks about this all the time, we're dealing with a range of different communities. We're dealing with folks who are in active use, and that's a whole different situation than a school or some of these opioid naive populations. So
Yep.
Yeah,
sometimes,
because we really have, I think what we really have is 2 different groups we have many groups of people overdosing, but the reasons they're overdosing can kind of be put into 2 buckets, right? So you have people who are actively using drugs, and those individuals obviously might have a little bit more knowledge, probably much more knowledge about how to administer
Mm.
naloxone, what it means to put someone in a recovery position, because there's a lot more about responding to an overdose than just administering
Mhm.
Yeah,
naloxone. I think sometimes
absolutely.
people
Yeah.
don't realize that. And then you have this other group who is probably not using drugs. They might be trying something for the first time and find out it's laced with fentanyl, or they might have shared a medication that happens to be counterfeit that's laced with fentanyl. that group of individuals is very naive about how to use naloxone. In fact, studies show that only about 1 in 7 college students know how to use it. So,
Wow.
that having that instruction for that population is extremely, extremely important. And in both of those populations, people who are in active use and college students, the likelihood of responding to someone that you know is very, very high.
Mhm.
And giving Joe CPR for me would be a very different experience than giving a person out on the sidewalk CPR, right?
Yeah.
Because I know Joe and Joe's important to me. So I'm likely to panic more if I have to administer any kind of medication to him in an emergency
Yeah.
situation.
So what we've seen is, by yeah, actually, it was revealed to us. These boxes are getting used in a multitude of ways that I didn't even imagine. So, for example, in an active use population or a recovery home, they use this on the onboarding, like literally, and we've seen it even in Applebee's and restaurants. When
Awesome.
you get done with your W-2 or your paperwork, then you open the box, you hit the training mode, and once you watch that, welcome to the team or welcome to
Oh,
our recovery.
wow. Hmm.
Also, in an active use population, we see they reorder these PPE kits and basically use it as a vending machine, right? The
Yeah.
naloxone's in there. You grab the wipes, you take it, you take the training if you need it. You may not, but you always know where to find it in the purple box. And then again, like when you talk to Mike, we have a whole other, these kids going to, and I say kids because I'm getting old, but they go to a bar and they try a drug for the first time, whether, they think it's cocaine, they think it's another pill, even Adderall we've seen, right? So these populations are using it as an emergency.
Yeah.
It's the fire extinguisher, it's the AED. So we've watched it grow and be used again by so many different people in so many different ways.
No, absolutely. So now, if let's say a school has a box or, like an allocation, so they can put their naloxone in the box, right?
Mhm.
Yes.
Yeah.
So,
Yeah.
this way it doesn't expire. That makes
Yeah,
sense.
and we also have a tagging system. I don't have it right in front of me, but it holds a little green tag that says contains naloxone.
Ah,
So
okay.
that you can visually, again, some campuses, some arenas have 20, 30 boxes spread out. So that's a
Okay.
full-time job if you're checking every day. So
No,
you
that's
can
for sure.
visually see the tag on the top and know that it's loaded. And if it's not there, you can, and again, it breaks off. I spent over a year trying to find just the right tensile strength. It's because again, I didn't want that to, you have to administer naloxone. You can't get the
Yeah.
daggone box open. So we made it very simple, but that way plant services, security, whoever's in charge of making sure the box has naloxone can just visually see it at 100 yards and say that one's good or this one needs
And
refilled.
most of these places have, fire extinguishers. Hopefully all of them do.
Yeah.
Um,
Yeah. Yeah.
and many have AEDs, depending upon the size of their organization or building. And so these are often placed in those emergency locations. So in most cases, somebody has an individual or a point person who has to check those other emergency response mechanisms. And so this is just another thing to add to that checklist. And what I always tell people is I recommend putting it on the wall in such a way that you can remove it. So, for example, if I'm in a residence hall on a college campus and the overdose is happening on the third floor, but the box is on the first floor, I want to be able to grab this and run up the stairs.
And that's why we included these, easy mounts. You just push it up and pull it off. Or again, you can tuck that away and put it behind a bar, put it in, another first aid kit. It just depends on the circumstance.
Yeah, the libraries in West Virginia don't have them on the walls. They keep them like this behind the circulation desk. So it's recommended for public facing, but sometimes people don't want it public facing, but they still want it. So there's a lot of different ways that you can still make this present in a workplace.
Yeah, no, absolutely. Now, can you tell people, with Mike, we went over that, but please tell people again, that they think, that they're going to be liable for whatever. I know it's a big thing, but can you clarify that?
Yeah, so in the United States, every state has a Good Samaritan law. And it applies to naloxone administration and responding to an overdose in the same way that it does to, using an AED. The difference is with an AED, the likelihood of you actually saving that person, if you look at research, is really low because by the time that person's having a heart attack, you would have to respond pretty darn quick before EMS got there. So this is a little different because really that response was in 2 to 3 minutes. So as long as you administer it, call 911 and don't leave the patient until EMS gets there, you're covered.
Yeah.
And so it makes it a lot easier to be a bystander in those situations, knowing that. We also have a lot of organizations that say, well, I don't want to be liable for administering this. Well, we know that there are a number of places, including universities, that are actually getting sued because they didn't have it. And so now there's no reason. I mean, naloxone is very well known. I mean, in the 1970s, it wasn't. It was only in emergency rooms and on ambulances, right? And you might come across it in a medical show on TV, but now it is pretty commonplace and talked about regularly. So when we talk about liability, we talk about foreseeability. And typically, when someone is sued, they are held liable if they could have foreseen that something was going to happen, right? Well, given the number of overdoses that we have annually in the United States every year, and the fact that we've had them in locations from school buses to school gymnasiums to college campuses to bars to restaurants to libraries to street corners, that foreseeability is already there. So putting this in place helps with that liability and helps make sure that you're keeping your employees, your students, and your community safe.
Yeah. No, absolutely. Now, the ONEbox has now been distributed in all 50 states with over 400 lives saved reported. What does it take to get a box from manufacturing to a wall somewhere?
Well, I'll let Joe talk about the manufacturing part, and then I'll talk about getting it to a wall somewhere.
Perfect.
Well, in the beginning, we had what we thought was a beautiful mission. I wanted every single one of these boxes to be created by hands that were in recovery, active recovery, so that they could pay it forward and be of service. But then Susan started getting calls from all 50 states, and we had to scale
Keep up.
super quickly. So I spent a lot of time finding just the right partner in the United States and building the process so that it was super simple. And basically, when a customer or an organization calls and say they need X amount, we just have them shipped directly to them. So we've really worked on all the obstacles and barriers, which again, this is so far out of my wheelhouse. I make videos and music videos and things like that. This learning, the learning curve was pretty steep in the beginning. We were able, to just keep refining it. And once we got that process set, I believe it's set now on the manufacturing side for sure.
And I think, most communities are purchasing these with opioid settlement dollars, which I think is a good use of funds. I mean, I think there's a variety of things that need to happen with those funds, but certainly overdose response is one of those. And so I think it's a good use of those funds, but then what they're doing is they're looking at their community.
Mm.
So, for example, the way Baltimore deployed is not the same way Nashville deployed. Nashville has 7 million visitors a year. The majority of those are downtown near Broadway and the honky tonks. So, Nashville Police Department said, okay, let's look at our OD maps and see where overdoses are happening. They happen to be happening in those places and in
Yeah.
those zip codes. So that's where they started implementing the box. Baltimore said, let's put these in our metro stations and in communities where we know, significant numbers of overdoses are happening. So when Baltimore had 25 people overdose in one day, they contacted us and said, can we get some boxes for that area? And of course, we said, of course, and sent them. They've since purchased more to put in their metro stations, but we sent some to them gratis a few days after that happened because we knew obviously that was a community where naloxone was lacking. There's a lot of research to suggest that unfortunately Black low socioeconomic communities do not have the access to naloxone that some of our other communities have. So the response and where to put these in Baltimore was a little bit different. And then you have communities like Wilson County, North Carolina, who pretty much just put them everywhere. I mean, coffee shops, bars, and restaurants. They're in churches. They're in the courthouse. I mean, they just kind of said, we're going to make this commonplace everywhere because we want to reduce the stigma of having naloxone present. It should be just as present as a fire.
And that I would venture to say is one of the least stigmatized counties
Yeah.
in America. And again,
Okay.
not where you would think you're going to see naloxone. I can't even tell you. We went for a visit after they deployed, and every coffee shop, every church, every nook and cranny had a
Wow.
purple box. And then again, she was mentioning Nashville, and you had the pleasure of talking to Mike Hotz, an amazing gentleman that spent more than 2 years spending the last hour of his day just going to bars and educating them. And they've reported 15 reversals just on, Broadway, that one little strip. But what we've also seen is they had a pretty robust naloxone program, but it was sitting in a storage room, right? They couldn't get it out
Yeah.
because nobody wanted to touch it with the liability. Once they got these boxes out, Mike would go through, check the boxes, and see if they need refills. So by having hundreds of boxes, they've now distributed many thousands of doses of naloxone.
And that's what I say. This helps with deployment. So one of the things that we're starting to try to get better at in the United States is tracking naloxone saturation. So we already track overdose deaths in a number of ways and a lot of robust data collection points and bases. But we're not doing such a great job at naloxone saturation. West Virginia happens to be doing a really good job because they're tracking both in their OD maps. And then you can lay over your overdose map and your naloxone saturation map and say, oh, okay, because 10 doses of naloxone for every overdose is kind of the formula in the
Okay.
research, right? So I think what happens is this helps with that deployment because what I say is saturation is not deployment. So if I say 1,500, doses of naloxone have been deployed at 118 Capitol Street in Charleston, West Virginia, that's my office. That just means there's 1,500 boxes of naloxone sitting there.
Yeah.
It doesn't mean that they're out in the community.
Mm.
And so I think one of the things the box helps do is say, okay, we've got these deployed in every metro station, in 25 bars, and on every school bus, those kinds of things. So it helps with that as well. I do think it's important to carry naloxone on your person. We do all the time. And certainly on airplanes we do. But I think, we also have vending machines, but I'm not going to walk 6 blocks to a vending machine if that emergency is happening right there, right? So having that box and the extra set of instructions there just helps people build confidence and increases the likelihood that people are going to respond as a bystander.
And it really scales these communities. We've done as much learning as we have in training. A lot of communities will give them a single one box and 10 boxes of naloxone because of their need. They'll basically say, here's your, I usually call it the razor blade razor, right?
Yeah.
Like the Gillettes. Here's your handle. Now, how many razor blades are you going to need for your specific situation? And through that, and that was another reason we created the one box, is we had friends that were Jan Rader, other folks from West Virginia, all around the country that were sitting with what I called a ticking time bomb. It's expiring naloxone in a back closet that they are every day diligently trying to get out there, but it's still sitting in storerooms. So part of the reason to make this box was to get it out into the world.
Yeah, no, that's awesome. Now the Be the One campus initiative reached all 29 college campuses in West Virginia. Can you explain what Be the One is and what made campuses such a priority?
Well, I think for me, it became kind of personal that the campuses were a priority, to be honest, because I, had worked in higher ed for almost 30 years. I had responded to an overdose on campus. We have something called the West Virginia Collegiate Recovery Network in West Virginia, which we're very fortunate to have. It's not funded at the level that I wish it was, but we're very fortunate to have it. And their executive director, Susie Mullins, we call ourselves Susie Squared, and I were kind of on a personal mission to get naloxone on every single college campus. She also knew of somebody who had overdosed in a parking garage on one of our college campuses. And so we knew that this was an issue and was likely to become more of an issue as we saw counterfeit pills. This was also around the time that there were 2 or 3 students from Ohio State University that had overdosed trying cocaine. And so this became really, really important to us. And Susie and I were already working together to do medication safety training on college campuses. And
Mhm.
some of the campuses were including that training in their courses. So they were including them for their nursing students, their addiction study students, and things of that nature. And so Susie really worked to build this program that has many components. One of the components is that all of the campuses have a ONEbox.
Yep.
The other component is that the campuses are utilizing that medication safety training. She has also added fentanyl awareness training and ally friendly training in cooperation with the SAFE project. And so that talks about how we can better support students and others in recovery on our campuses. And she's also worked very hard to get fentanyl and other drug testing strips available on college campuses in places that are a little more inconspicuous, so students don't feel like they're being watched when they take
Yeah.
them.
Yeah.
I would say that the other person that's been very helpful with this project is Jan Rader, because she, along with some of the sociology instructors at Marshall University in Huntington, our hometown, have started to reach out to fraternities and sororities and place these in fraternity and sorority houses. In fact, I know of one sorority in Huntington, they have a there she goes. They have a go bag. So there's always one person that goes out and they're sober and they bring water, aspirin, all that stuff in a backpack. Well, now they've added their ONEbox naloxone to their go bag. So we've watched it become adopted. We've got over 200 campuses across the country now that have ONEboxes. North Dakota
Wow.
State University was able to purchase them through SOAR funding and put them on all of the campuses in North Dakota.
Yeah.
So
And
Wow.
again,
it
yeah.
caught fire. It
And
really
Marcel,
caught fire.
it really, back to an earlier question, that was the genesis of the entire ONEbox. Like it came with trying to get 4 boxes on each one of these 29
Yeah.
campuses. And once we got through all of that red tape and just overcome every single objection, because that was what the first 6 months was. I had the box 2 days later, but it took us a year to overcome every objection, and lawyers and tables of lawyers, and just trying to make sure foreseeability and liability
Yeah.
down. But just one more thing with the college campuses that we just love. A Georgia campus, they check them out.
Yeah, I
They
love
they have basically like a library, and if you want to go train your sorority or your chess club or whatever, you go to, I'm just saying the library, but I'm sure it's a public health
yeah.
situation. But
Wellness office.
you just go and you check it out for however many days and go train everybody, and they will give you naloxone to leave behind. And in some cases, I'm certain they let them keep the box if the need is there. But
Wow.
we've just seen so much grow out of the campuses. And unfortunately, one of the things that is just heartbreaking, it's great when you get the phone call or an email. Usually it's an email about a save. But unfortunately, especially with college campuses, too many times we got the phone call and it was already too late, and they're
Yeah.
responding, but not first responding. It would be last responding or
Yeah.
too late
They're gone
responding.
Yeah.
already.
They'd already lost a student and they were trying to kind of build up their program. And, so we've seen both sides of it, but it has definitely turned a corner.
We also know that we're aware of that have been reported to us 2 saves on college campuses. So, that seems like a small number. We hope that no campus needs it, right? We have a fire extinguisher. We don't intend to set our building on fire, but we want to have it there just in case. So, been very lucky that people have shared reports with us of, lives saved.
I would say that would be one of the lesser reported
Yeah,
situations
Yeah.
yeah.
too, just because of the,
Stigma. It's
the
really
stigma
stigma
still
and
on the
liability.
campuses we
Yeah.
deal with.
Yeah. I mean, one life saved is a win,
For sure.
period. So now
Well,
you've
we've
also worked with, go ahead.
I was just going to say, we've heard of lives saved at an EDM music festival in Boston. There have been 15 saves in Nashville. We had a really touching email that came from the pastor of a church in a really rural community in Appalachia there had been a young woman that was in a recovery center, and she was released and unfortunately started using again. She went to a recovery meeting and overdosed right at the recovery meeting. And fortunately, that pastor had had the foresight to put in one box with some naloxone in the church against his congregation's wishes, by the way.
Okay.
And it was used that night, and the mother contacted us and said that it took 25 minutes for EMS to get there, and that if the one box had not been used, her daughter would not be
Yeah,
with us.
that's for
Yeah,
sure.
and the EDM festival she mentioned, it was not in Boston. It was way out
Yeah.
in the suburbs,
Okay.
and they said it took almost an hour at that point. And
Wow.
literally, that was one that always comes back to me because the guy put the box in his trunk and left it there for almost a year, he said. And he just yelled out. He was on stage playing, and he said, "Go to my Toyota Tercel
Wow.
and get in the trunk, and there's a purple box." And they say that was a life save. So those
Wow.
stories definitely,
They keep
you know,
us going for
Yeah,
sure.
no, absolutely. Absolutely. Now, you've also worked with law enforcement, including partnership with officers like Mike Holtz in Nashville. What
Mhm.
does a strong community partnership look like in this work, and what makes those relationships succeed?
Well, first, I will say I think law enforcement is key. And I think the attitudes of law enforcement about naloxone and reviving people in recovery has really shifted a lot in the last 10 to 15 years. And so we have found that police officers are often the champions in the community who will push projects like this forward. They often don't have the funding, but they can push someone forward who does have the
Hmm.
funding and get involved then with deploying the boxes. We have some police departments that are carrying these boxes in their trunks
mhm.
Yeah.
of their police vehicles. We have other police departments that are using them with quick response teams when they go out and talk to families and after an overdose has occurred and leave naloxone behind with those families. We currently have a project through the Institute that's supported by the Appalachian Regional Commission that puts 13 people in counties throughout West Virginia, Kentucky, and Tennessee. All of those employees work directly with law enforcement as part of their role to get one boxes into those communities as well as naloxone. So I think those partnerships are really key. Universities have been key. North Dakota State University started by wanting to put them on college campuses, and now they're in bars, restaurants, transportation hubs. They're all over the place.
Private
Private
corporations,
corporations can be great
Gibson.
partners. Yeah, one of the reasons why this really caught fire, I will say that when Joe first invented this, I don't ever think he thought he would be sitting here saying 30,000 of these are out because
Yeah.
that really wasn't the
Yeah, we were
intention.
trying to make 100
We're
and be
just trying to
done.
make
Yeah.
100. So we got a lot of organic press about that. And I was in the office one day and I got a call from Gibson. And Joe is a guitarist. I am not a musician. And I got off the call with Gibson and I said, Joe's going to be so mad that I just talked to Gibson. But they wanted to fund the Nashville project, and so
Wow.
they were really the ones that provided the seed money to do the project in Nashville. So just like, the School of Pharmacy at North Dakota State University really seeded the project for the state of you know, North Dakota. Wilson County Prevention Coalition seeded the money for Wilson County and then shared that work with other counties in North Carolina. And it just kind of caught fire that way.
Yeah.
Getting back to your point on the law enforcement, I will say Gibson bought a number of boxes and they tried to put them out in the community with absolutely no response, zero. We had such trouble and we were really, kind of down
Oh,
about that.
yeah.
And then Mike Hotz started on his own time. I say it's the last hour of work. I believe most of the time it was after his shift. And there's something about a law enforcement officer walking into your bar or your business and saying, "Hey, we want you to be safe. We don't want to be called out here to a scene where someone is already gone. Help us help your patrons. And let's just be honest, your employees."
Yeah.
Right. So that really made a shift. And I would say out of all the programs we have, the ones where we have law enforcement heavily involved, it
Yeah.
really makes such a difference
Mhm.
because especially someone who is opioid naive or someone who wants to help because they've seen it on TV or heard that there's a problem, but they're so far removed from it, having an officer assure you that there's no liability, it's safe, and it's easy to use makes all the difference in the world.
Yeah,
I have
that's an
that
authority. So
police
yeah,
officers also have a lot of compassion fatigue, right? So they're responding to a lot of these. So if
yeah,
they can prevent having to respond to these because people know what to do, or at least when they do respond, the person's
Mhm.
alive,
Yeah.
that certainly helps with their work as well.
no, absolutely. Now, there's ongoing debate in the substance use field about harm reduction. Some see it as enabling, others as essential. Where do you both land on that, and how do you communicate the one box value to skeptics?
Well, I think it's pretty obvious where we land on it.
Yeah, no, I totally
Uh,
understand.
for me, I go back to the fire extinguisher example, right? We have a fire extinguisher, but we don't ever intend to set our building on fire, but it could happen, right? So it's just like, if you're a parent, you don't like to think that your kids will do these things, but they probably will. So you want to inform them and make sure that they're safe and making good decisions. And I don't think that you can adequately respond as a bystander unless you understand both the problem and the solution. And I'm not saying naloxone is the solution to addiction. Please don't mishear me, because there's lots of things we need to do on that route, but we cannot get people into recovery if they're dead. And so we have to make sure that as a society, we proliferate the United States with naloxone and training in the same way that fentanyl has proliferated our drug supply, whether that be our illicit drug supply or our counterfeit pill supply, because it's everywhere. And we're seeing more and more powerful opioids out
Mhm.
there. That are 50 times more powerful than fentanyl, which is scary when you think about a sugar packet of fentanyl could take out a whole room of people, right?
Yeah,
So it's getting a little bit scarier in terms of the potency of some of these
Yeah.
drugs too.
yeah, and
Well,
also the fact that it's mixed with other drugs that people doesn't even know
absolutely.
they're taking it. So
And I've come to understand more about, again, I was convinced in the very beginning of this 20-year journey that uh, prevention and recovery were, the two absolutes. Harm reduction, I actually met Susan while she was working in the harm reduction program. And I'll be honest, here in West Virginia, they butt a lot of heads. They closed down some harm reduction programs,
yeah,
and the community suffered. So it's really more about education and, as far as the harm reduction side of it, we do think that seeing these purple boxes around and just normalizing it a little bit kind of tones that down. But we've seen all across the country people just kind of coming around on harm reduction. It's
yeah,
it's now proven that it does help. So it's part of the model. You have to have all three.
yeah,
Well,
no, absolutely. Now,
I don't.
what's the go ahead,
I was
Susan?
gonna say, I don't think we ever want to say that, I don't think any of us advocates for people to use drugs.
Yeah,
It's obviously that's not a choice or a behavior we want anyone to engage in. But I would also encourage people to understand how addiction is different than other diseases in terms of it only takes 2 or 3 days, if that, to become addicted to an opioid.
yeah,
And unfortunately, opioids rewire the brain in such a way that you will do anything to
I get
chase
it.
that high you get the first time. And
Yeah,
it's just a really ugly, horrible disease in that way.
yeah, no, you're right. Now, what's the hardest part of scaling this program nationally? Is it funding, politics, community resistance, or something else?
All
Or
of it.
or all of the above?
And
So,
again, we've said it now 3 times. I planned on making 100 of these, and then that 100 moved to, all right, if we could make 5,000 of them with folks in recovery, and then the next thing you know, we're at nearly 40,000. We're like 35,000 plus. So we were never prepared for this. We didn't know how to run a box making company, where to get all the components. I mean, it took a big learning curve. I believe Susan and her organization and help from across the country is why we scaled. Again, we didn't go out with a marketing plan to scale up. We just met the demand. And there were times we couldn't meet the demand immediately because we didn't have enough inventory and they had to be
Yeah.
built. So what we've been doing lately, this is very recent, I decided on the manufacturing side that I just didn't have the tools or the knowledge to really scale this to where it needs to be. We don't need 30,000 boxes. We need 300,000 boxes, and we need the price to drop significantly, even though we've dropped it more than $100 since the day we invented it. It really needs to be so much more inexpensive. And that's going to take someone who knows the distribution, who knows manufacturing better. So recently, very recently, I partnered with a distribution company that's just phenomenal. And their entire company is built around this problem. It's the only problem that they address. And already we've seen the boxes go into places I would have never even thought of, like the PGA Tour on every stop, and just so many new ideas. And also they have ideas for how to margin mine and how to get every pack of gloves down
Yeah.
10 cents by buying a million pair of gloves instead of just things I wasn't prepared for. So we're very blessed to have people step in. Again, the first 30,000, it scaled itself. People saw the box. They just wanted a solution and it worked. So I believe that with the new help that we have, we'll see it scale even further. But Susan probably dealt with more of the scaling issues than I did. I just built the thing.
Yeah, I just think it happened very organically. I mean, we got the first 100 out there, and then we started getting phone calls from Nashville and North Dakota, and let's do this. Let's figure out a way to make this happen. And then it just sort of caught fire very organically. I mean, in the beginning, we weren't really going to any conferences to talk about it. We weren't doing any kind of marketing. We just wanted to we just knew we had to get naloxone out there, and we had to get the stigma from the naloxone. Um, we had to combat that.
And
We just
yeah,
knew it from being in West Virginia and from seeing it and living it every
Yeah.
day. And that was really the main goal in the beginning.
I think the thing that really speaks for scaling is the fact that until we got with this distribution company, we have no sales force. We had
Yeah.
one person on the phone, and that was Susan. And we, she's not a salesperson. She wasn't trying to get large orders by cutting this and doing, like, we were just answering the phone. And
Yeah.
unfortunately, she's been answering the phone. Well, not very fortunately, actually, she's been answering the phone by herself for 3 years. And until
Wow.
we just partnered with a distribution company who will take basically control of the whole process, we were just trying to keep up and trying to keep people alive.
Well, and I don't think I don't know Joe says sales team, and I don't think that there's a cost to making the box, right?
Yeah.
You've got to cover those costs. And then you, of course, have employee costs and things of that nature to get these things deployed. And I think one of the things that Joe has been very intentional about, sometimes to his own financial detriment, is to try to keep this box price as low as we possibly can. And the only way that you can get that box price down without eating those costs is to scale it.
Yeah.
And so that's really the
True.
next step, I think, is to scale it. Because if we look at, I know that there's a lot of things out there saying that, oh, we're down in overdose deaths, the number of overdose deaths in the United States. And you look at a piece of paper, right, and you say, okay, 106,000 deaths versus 75,000. That's great. That's a deduction. However, we're at pre-pandemic numbers right now. So we really aren't any better off than we were prior to the pandemic. So we still have a lot of work to do. We still have a lot of costs associated with overdose, from ambulance transportation to ER visits and things of that
The
nature,
workforce implications.
workforce
Oh,
implications.
Yeah.
And so if we don't wrap our arms around this problem, then we're going to suffer even more. So it's not just about getting the numbers down. So it's also about getting people into recovery, right? It's
Mhm.
also about making sure communities have the resources and the beds to get people into recovery. It's making sure that those recovery programs do what they're supposed to do. So we're not having people go back into recovery
Yeah.
programs after the fact. So there's still a whole lot of work to be done, and it's going to take a lot of people to make it
Yeah,
happen.
and it doesn't take a mathematician to figure out the 400 lives that we associate or know about that are saved didn't make that 25,000 or 30,000 uh, person differential, but it's because a lot of different programs and a lot of good people with a lot of different ideas. Listen, this box isn't for everybody. We always say, we've said it from the beginning, just get a place to put it and let people know it's there and make sure they're trained or at least feel confident, right? So there are lots of wonderful, folks out there with so much innovation. We've seen so much innovation come to this space in the few years, and that's why I believe that we are seeing these numbers because of proliferation and reducing the stigma, which we've been talking about for 15 years now. But it seems like now it's starting to happen, and just new ideas in the marketplace and beyond. We also say all the time, what is going to, and we hope it probably won't be us, but what comes next? What is the
Yeah.
next great answer? What is the next great way
Yep,
to solve this?
totally.
Um,
Well, we can't take our eyes off the prevention side of things too, right?
Yeah,
So,
totally.
one of the challenges in West Virginia and in other parts of the country is that we have a large number of children being raised by grandparents or aunts, uncles,
Yeah,
brothers, sisters, directly because of the opioid epidemic, right? And
yeah,
so we have that whole generation, multiple generations of children that we need to educate and make sure that they don't end up in the same place their
yeah.
parents did. That's a challenge. And so I
mhm,
think the prevention piece still becomes really important. Access to recovery, having enough
and
recovery
harm
beds
reduction.
and harm reduction programs, all of those things, all of those are tools in the toolkit that we need to continue to
And
support.
all of our comrades out there and colleagues that have been fighting this fight for 15, 20 years, another thing is the compassion fatigue we talk about so much. And if we feel it at our level, you can only imagine, again, from the recovery homes and the EMTs that are dealing with this every day, we've all been getting beat down for nearly 20 years. And so having a community that works together with new ideas has really, I think, we started
No.
to turn on that.
Yeah, absolutely. And I think also on the medium term basis, to really educate the kids about it, like
Absolutely.
Yes.
younger. So, because, a treatment takes months, sometimes several treatments
Yeah.
and so on. So, absolutely.
Well, that's how we actually started. We started working with the idea. We had a 5-year-old and a 3-year-old in our community get a hold of grandma's medication and overdose. So early on, that was one of the
Oh,
first things we set our sights on. But again, all age groups, from 4 to death, right?
yeah,
To
totally.
100-year-old, everybody getting educated and releasing the stigma. But it feels like we are making some changes.
Yeah, no, absolutely. Now, to end, what advice would you give a family member, employer, or anyone in contact with someone using opioids legally or illegally and, could be prone to an overdose?
I think I have a couple things. One would be to get naloxone. And if you don't have naloxone in your purse and in your medicine cabinet at home, whether there's an active user in your home or not, you should have it because you never know somebody visiting. You might have a child home from college who's tried something for the first time. So just having naloxone available and accessible in the home and carrying it on your person and knowing how to use it, I think is really, really crucial. I think for parents, and sometimes this is very hard. I mentioned Joe and I have 6 kids between us. The youngest is 20, the oldest is
34.
34. And so having open and honest conversations
Yeah,
and being willing to hear what's going on in their life without passing judgment. Being willing to say, okay, so you're in a fraternity house. Do you need fentanyl test strips? I'm not asking if you're using, I'm asking if your fraternity house needs fentanyl testing strips.
uh,
Having those kinds of open communication, I think, are so important for parents. And sometimes we're so afraid of it. And I think there's a lot of organizations out there that are making some headway in how to, facing fentanyl, Mothers Against Prescription Drug Abuse. Those are two that mind immediately that have some great tools for how parents can start those conversations. The other thing that I would say is we need to focus on the elderly population. West
Oh,
Virginia, in particular, has a very aging population. We're seeing overdoses increase among that population. That population is also more likely not to have an opioid prescription and to not store it correctly.
Mhm.
So I think really focusing on educating that population about putting medicines up and out of the way, not just from young grandchildren, from older grandchildren too, right? You want people to know where your medication is. Talking to folks about disposing of medication properly when they're not using it, and also talking to older persons about the dangers of and the likelihood of overdosing if you misuse that medication, I think is really key.
And I
yeah.
think, just to wrap it up, I'll share a couple of stories that became the advice I began giving, and it happened around the ONEbox, but it could be just around naloxone in general. Um, for one, the employers, we started seeing the employers doing the onboarding process.
Mhm.
That opens the conversation up with an employer that this is a safe space. We're looking out for you, not just for our customer, but we care about you. And I think that really helps, especially in a population that we have here where, we're dealing with it at the workplace so much. So having an open conversation with employers, also family members, I've seen it on both sides, again, with the ONEbox, but this extrapolates to just naloxone. A gentleman shared with us that he wanted a ONEbox, and then he shared a story and said, the first thing I did was I went to my parents and I said, I have been in recovery for 6 months now, and I do not have any plans on relapsing, any plans on using, any plans on messing up or going back. But if you see me unresponsive, if I'm acting a little strange, if I'm not responding to you, don't think it's going to hurt my feelings to assume the worst, because this is a hard disease to get through. And the kid said, it was a really young man. He said, and I've got this box, and inside of it has everything you need. And I just want you to know that. So again, not just to do with the ONEbox, even if that conversation is about naloxone by itself, this is where I keep it. I have no plans on using, but if I do, here's where you find it. And that's how it's all about communication and connection.
And I think talking like that is so important. I'm thinking of another time when Joe was talking to a young man about the ONEbox, and we were in a small group of people doing a training. And, the young man kinda hung back and he stayed, he's kind of shifting back and forth on each foot, and everybody had left the room from the training, and he came up to Joe and he said, "I think I need to talk to someone. I think I have a problem." And just by talking and training on naloxone, that person felt comfortable enough to come to Joe and say, "I have a problem with drugs and I have to talk to somebody today." And that was a very emotional day for us because it was also a day that Jan Rader was there, and another individual raised their hand and said, "Jan Rader, you saved my life."
22 times.
Wow.
She had resuscitated the same man 22 times, and he said it took the 22nd time for it to stick, and he'd been sober for 8 years at that point.
Wow. This is one thing that when I did the podcast with Jen, she was saying, I don't care resuscitating like someone 10 times if it gets them to a treatment and, they
Yes.
get their life back. So,
We've heard that same story about Jan more than one
Many
time,
times.
16, 10 times. Like,
She's a
wow.
dime.
we always say we believe she's probably resuscitated more or responded to more overdoses than almost anybody that we've ever heard of in the entire country.
Wow. Wow.
Takes
And
heroes.
she does it every day still, so
I know.
she's going to continue fighting the fight. She really believes in it and, has done a lot of hard work, not just in our community, but around the country.
Yeah. Yeah. Amazing. Susan, Joe, thank you.
Thank
Thank
What
you.
you.
Appreciate
w-
you.
what you've built with the ONEbox has proved that one idea in the right hands can save lives. 400 families still intact across 50 states. And by the way, probably there's more that you
Yeah.
don't know. So that says it all. So there's going to be a link in the transcript for all your work. So if anyone wants to get on your website,
Right.
it can get to the right person and will save a life.
Thank you for having us, and
Thank
thank
you
you for
so
your work,
much. Thank you
Marcel.
for your work. Yes.
My pleasure.